postpartum period and associated complication. Chapter name. First of all, what is postpartum period? So the period when the reproductive tract returns to the normal or non-pregnant state. So when a mother continue the pregnancy and give a birth of the baby, after the delivery, the time when mother uterus or associated organ go back in the normal position, normal anatomical or physiological position, right? Or non-pregnant state. Postpartum period start immediately after the birth and is usually completed by week 6 following the birth. Next here, normal postpartum vital sign. So after the delivery, if you check mother vital sign, we will get temperature may increase up to 104.4 degree Fahrenheit. If you converted it to Celsius, it would be 38 degrees Celsius during the first 24 hours. And because the dehydration effect of liver, any higher elevations may be caused by infections and must be reported. Pulse may decrease to 50 beats per minute. And pulse rate, if more than 100 beats per minute, may indicate excessive blood loss or infection. So we need to monitor. Because of excessive blood loss can lead to hypovolemia, which lead to cardiogenic shock, or infection can lead to septicemia. Blood pressure should be normal. Suspected hypovolemia, if it is decreased, hypotension occur. Blood volume reduce, blood pressure reduce. Respiration, it is very uncommon to change. If respiration increases significantly, suspected pulmonary embolism or uterine atony and hemorrhage. What next? Physiological maternal changes. So the rapid decrease the size of the uterus as it returns to the non-pregnant state. The client who breastfeed may experience a more rapid involution due to the release of oxytocin during the breastfeeding. Data collection. Weight of the uterus decreased from 2 pounds to 2 ounces in 6 weeks, and also endometrium regenerate. The fundus steadily decrease into the pelvis, and the fundus height decrease about 1 finger below per day. So you see how the size is reduced and go back the normal posture or position. By the 10 days of postpartum, the uterus cannot be palpated abdominally. The flaccid uterus indicate uterine atony and should be massaged until the palm. So sometimes NCLEX board asks the question from here. A tendon fundus indicate infection. After the pain, decrease the frequency after the first few days. Physiological or maternal changes continue in evolution of the uterus. So the height of the uterus standards decreased by approximately 1 centimeter per day. So here showing, you see, this is the uterus. Go back. Day 1, it should be around umbilicus. And day 3 below umbilicus. And it said that day 8 is almost touched to the pubis symphysis. About the lochia, so discharge from uterus that is consists of blood from the vessels of placental side and debris from the decidua. So lochia, if you assessment lochia, we can say rubra, it is bright red color, bloody discharge, right? That is occurred delivery day, day 2, day 3, 1 to 3 postpartum period. Basically, the rubra, no odor or slightly fleshy odor. So 4 to 8 pairs per day is normal, right? So serosa, it is pink color or pink discharge or pinkish brown. It is serous discharge. Usually start from day 4 to 10. Some books say day 5 to 7 days postpartum. Also, serosa is no odor, no smell. Elba, it is white discharge. Some books say creamy yellow. It may be brownish 1 to 3 weeks after postpartum. So 11 to 14 days postpartum, but some book wrote 1 to 3 weeks postpartum. Elba is no odor or body odor. So normally the discharge smell like normal menstrual flow, and discharge decrease daily in amount and discharge increase with ambulation. As I told you, at the first 1 to 3 days, if mother complain 4 to 8 pads get wet per day is normal. So mother are not the educated like a doctor or RN. They do not say what the amount. So easy way to measure the number of the pads, how many get wet per day, right? The scanty less than 2.5 centimeter and heavy bleeding saturated in 1 hour. So next here, physiological maternal change continue. So here, cervix, vagina, and other function and menstruations. So you see the cervix involution occur after 1 week, and the muscle begin to regenerate, right? So it is the cervix occur. And then vagina said vaginal distension decreases, although muscle tone is never restored completely to the pre-gravid status. So in case of ovarial function depends on rapidity, which is pituitary function is restored, right? And menstrual flow resume within 1 to 2 months in a non-breastfeeding mother. And menstrual flow regularly resume within 3 to 6 months in the breastfeeding mother. And breastfeeding mother may experience amenorrhea during the entire period of lactations. So women may ovulate without menstruation. So breastfeeding should not be considered from a birth control. So what about the breast tissue? So if you check the breast tissue, you check for engorgement or mastitis. Also, you should check the nipple. Sometimes nipple is crackled. As a healthcare provider, we have to check it. So does the breast continue to secrete colostrum? The first milk secreted from the breast, pregnant mother breast, it is called colostrum. It is the best gift to the baby. It is full of immunoglobulin what protect your baby. First 40 to 72 hours breastfeeding is very explosive. A decreased estrogen and progesterone level after the delivery stimulate increase the prolactin levels, which promote breast milk productions, and breast become distended with milk on third day. Engorgement occur on approximately day 4 in both breastfeeding and non-breastfeeding mother. Breastfeeding receive engorgement relief. Non-breastfeeding mothers should avoid the nipple stimulation and apply a breast binder, right? Wear a suitable dress, apply ice pack, and take a mild analgesic for engorgement. Engorgement usually resolves within 24 to 36 hours after it begins. What about the urinary tract, gastrointestinal tract also? So if you check the mother bladder, always educate or encourage mother to voiding before check the urinary tract or bladder and uterus, right? And also we have to check the displace of uterus, right? When you check the uterus, we will check the fundus should be found at the level of umbilicus immediately post delivery. So what else? They say may have urinary retention because of loss of elasticity, tone, and sensation in the bladder from trauma, medication, anesthesia, and lack of privacy. Diuresis usually begins within the first 12 hours after delivery. What else? Gastrointestinal tract or bowel, right? So women are usually hungry after delivery. Constipation can occur with the bowel movement by second or third postpartum day. So assessment for presence of bowel sound is important. Also, hemorrhoid are more common, right? And some mother go for episiotomy, right? We have to take care of the mother who need episiotomy. Right? We will talk. So next here, data collection. Monitor the vital sign. Monitor the pain level. Means in 0 to 10 scale, how much pain? Like if mother say 8 out of 10, is important to take care of them. Monitor the height, consistency, and location of the fundus. Monitor the color, amount, and order of the lochia. Check the breast for engorgement. Monitor the premium for monitor the perineum for swelling or discoloration. Monitor for the perennial laceration or episiotomy for healing. So if we see the redness, edema, or ecchymosis, any discharge drainage, we have to keep a note. So check the incision drain to the client who has a C-section or cesarean section. Monitor the intake and output chart. Encouraging frequent voiding. Monitor the bowel status. Encouraging movement or ambulation. Right? So you can prevent the deep vein thrombosis. Check the extremity for thrombophlebitis. So you see this is the mother. Mother was immobilized for a long time. So mother chance to develop deep vein thrombosis. How you understand deep vein thrombosis? If you see redness, tenderness, or warm or hot in temperature in the leg, right? It is good to check the Homan sign. So Homan sign should be absent. Means mother do not have any deep vein thrombosis, no thrombophlebitis. Also, RHO immunoglobulin is prescribed to be administered within 72 hours postpartum to Rh negative client who has given birth to Rh positive newborn. NCLEX board like to ask a question from thrombophlebitis or deep vein thrombosis or Homan sign. NCLEX board also asks a question from here. If a mother is Rh negative and give a birth Rh positive baby, what we could do? We give them RHOD immunoglobulin. This is the answer. And rubella immunity will be evaluated. If not immune, then rubella immunizations would be administered. Monitor the patient newborn bonding and monitor mother's emotional status. Client teaching. So demonstrate newborn care skill as necessary. Provide opportunities for the mother to birth the newborn. Reinforce instruction to the mother regarding feeding techniques, and also reinforce the instruction to the mother regarding the feeding technique. Reinforce the instruction to the mother to avoid the heavy lifting for an last 3 weeks. Reinforce instruction to the mother to plan at least 1 rest period per day. So client teaching, right? So we have to teach how to take care of them. Also, we should talk about the correct way to breastfeeding. So reinforce the instruction to the mother that contraception should begin after delivery or with the initiation of intercourse. So intercourse should be postponed at least until lochia stoppage or ceases. With rubella immunizations, period conception for 1 to 3 months based on primary healthcare provider. So good to tell them not to conceive at least 1 to 3 months after rubella immunizations. Reinforce the instruction to the mother regarding importance of follow-up care, which should be scheduled at 4 to 6 weeks postpartum. Re-educate the instruction to the mother to report immediately may sign of chill, fever, increased lochia, or depressed feelings to the healthcare provider. So sometimes some mother complain of depression, and it is very common sign after the postpartum period. Nothing abnormal, right? So if mother is complain about the emotional disturbance, it is important to evaluate properly. It's good for the mother. So next, after the birth, pain occur as a result of contractions of uterus are more common among multipara or breastfeeding mother, or the client treated with the oxytocin, or the client who had an over-distended uterus during the pregnancy. The nurse should consult with registered nurse and check to the healthcare provider prescription regarding the treatment measure for postpartum discomfort. Then perennial discomfort, apply the ice pack to the perineum as prescribed during the first 24 hours to reduce the swelling. After the first 24 hours, apply the warm by seat bath. It is good for mother. Episiotomy. So instruct. So you see, this is the birth canal. Just facilitate, make the orifice bigger for delivery. We do a episiotomy. So always remember, episiotomy never do along to the midline. It is laterally, right? So instruct the client to admin perineal care after each boarding, encouraging the use of analgesic spray as prescribed, administer analgesic as prescribed if comfort measures are unsuccessful. So when you take care of the mother who have episiotomy, it is good to go for assessment for redness, edema formation, any ecchymosis, any discharge. Always keep it note. So here showing the perennial laceration, right? So you see, it is directly, if you do along the midline, it is a chance to continue with the anus, right? So it's a rectum, continue like this. So anal sphincter tone should destroy, tearing, and chance to develop the complication. So care as for an episiotomy, admin perineal care and use analgesic spray or analgesics for comfort. Rectal suppositories and enema may be contraindicated. Now, let me talk about the breastfeeding. So, encouraging wearing of a supporting cloth at all the time, even while sleeping. Encouraging use of the ice pack between the feeding. Also, encouraging use of the warm socks or warm shower before feeding for the breastfeeding mother. So it is important every student know. So during the breastfeeding, we encouraging mother to intake 2,700 to 2,800 calorie intake, and also 3,000 ml fluid if breastfeeding mother, right? And also sometimes mother have a problem inflammation of the breast, we call mastitis. It is educate your mother, it is your engorged breast. Put the moist heat, also encouraging breastfeeding or pump the breast. So if mother complain the engorgement, too much engorgement or crackles nipple, treatment is ice pack or open to the ear 10 to 20 minutes at a time. Mother who does not want to breastfeed, it is very important to educate whether tight fitting bra or ice. It is very important to educate. Also, uh, we need to prescribe some medication as well. If some medical condition, breastfeeding is contraindicated, it is good to know. So if mother has a tuberculosis or any radiation therapy, any herpes lesion on the nipple, or breast cancer, or mother diagnosis by HIV, or any medication like methotrexate, chemotherapy, or under the lithium therapy, it is good. Tell mother not to give breastfeed to the baby. So contraindication of the breastfeeding, right? So now constipation, encouraging adequate intake of fluid, encouraging a diet high in the fiber, encouraging ambulation, also admin, the stool softener, laxatives, enema, or suppository if needed and prescribed. Next, nutritional counseling, right? So discuss the calorie intake for the breastfeeding and non-breastfeeding mother. Nutritional needs depends on pregnancy height, ideal weight for height, and whether the mother is breastfeed or not. If the mother is breastfeeding, calorie needs increase by approximately 200 to 500 calories per day. So total calories, we have to encouraging 2,700 to 2,800 calories. So next here, breastfeeding intervention. So put the baby on the mother's breast as soon as mother's and baby condition are stable. Stay with the mother each time she nurses until she feels secure and confident with the baby and her feelings. Monitor for LATCH. L stand for achieved by the newborn attachment, audible swallowing, type of nipple, C for comfort of mother, H for hold or position of the newborn. So uterine cramping may occur during the first day after the delivery while mother is nursing, when oxytocin stimulation causes the uterus to contract. Instruct the client in general hygiene and to wash the breast once daily. So expected findings, we said 8 to 12 feeding per day is good, or 6 to 8 wet diaper of the baby indicate baby is get enough breastfeed. Also, 4 or more yellow bowel movement per day also indicate the good breastfeeding. It is the intervention. So mother should not use the soap on the breast because it tends to remove natural oil, which increase the chance of freckles the nipple. If the engorgement occur, have the mother breastfeed frequently and apply the warm pack before feeding and apply ice pack between feeding and massage the breast. So if the freckles nipple develop, expose the nipple to air for 10 to 20 minutes after feeding. Rotate the positions of the baby for each feeding and be sure that the baby is latched onto the areola and not just the nipple. So areola also put inside the mouth of the baby. So bra should be well fitted and supportive. Avoid any underwired bra or breast may leak between the feeding or during the coitus. So next intervention, calories should be intake by 200 to 500 calories per day. So how much total should be 24 hours? It multiply 200 multiply 24 hours. So, and also it is, you see, increased, not total. Total number should be, I said, about 2,800 calories. And the diet should increase additionally fluid and prenatal vitamins should be taken. Baby stools usually light yellow, seedy, watery, and frequent. So as I told you, 4 or more yellow bowel movement per day is normal. Medication include over-the-counter medication must be avoided unless prescribed because they may be unsafe when breastfeeding. Gas producing foods and caffeine should be avoided. Oral contraceptives that contain the estrogen are not recommended for breastfeeding mother. Also, progestin-only birth control pills are less likely to interfere with the milk supply. The baby will develop his or her own feeding schedule. Now, breastfeeding procedure for the mother. So it is good to wash the hands and assume a comfortable positions and start with the breast with which the last feeding ended. Also, brush the newborn's lower lip with nipple, means this is stimulating, right? Also, guide the nipple sounding areola into the newborn mouth. Make sure. Encourage the newborn to nurse on each breast for 15 to 20 minutes. After the newborn has nursed, release the suction by depression of the newborn chin. Also, repeat the procedure on the second breast until the newborn stops the nursing. Listen for audible suctioning and swallowing. Both is important. Postpartum discomfort. So, postpartum emotional change. What are the normal findings after the delivery? Acknowledgement the client's feelings and demonstrate a caring attitude. Determine availabilities of family support and other support systems, encouraging or assist the client to verbalize the feelings. Monitor the newborn for appropriate growth and development. Also assist significant other and other appropriate family members to discuss the feelings and identify the way of assist the client. So all clients should be assessed for depression during the pregnancy and after the delivery or postpartum period. So we categorize three types of postpartum emotional disturbance or depression. One is called postpartum blues, postpartum depression, and postpartum psychosis. So around 50 to 85% mother in the first 2 weeks, they are depressed. We call postpartum blues. 30% mother in the first year have this type of problem. We call postpartum depression. And 0.01% mother in the first 3 months, this psychiatric problem we call postpartum psychosis. In this table, we can see few signs and symptoms about the postpartum blues, postpartum depression, and psychosis. So mother who have postpartum blues, we say mother is easily get anger, under anxiety, or sometimes they cries without any particular reasons. Emotional, they are not stable. Also express a let down feelings, fatigue, headache, insomnia, restlessness, and sadness. So if mother develop postpartum depression anytime within the 1 year after delivery, they face anxiety, appetite change, or the cries, apathy, sadness, difficulty to concentrate or making any kind of decision, fatigue, unable to sleep, feelings of guilty or irritabilities and agitations, lack of energy, loss of responsiveness, and also loss of pleasure in normal activities. Also, develop the suicidal ideations. So the worst scenario we call psychosis. So breaks with reality. So they does not have any relation with the realities. Sometimes abnormal false beliefs. Easily confusion, delirium, delusions means mistrust, false belief, hallucination, false beliefs with perception, right? So again, let me tell you the difference between delusion and hallucination. Delusion is a false fixed belief, but hallucination is a sensory perception, but there are no stimulus. Sometimes another keyword you listen, this is called illusion. Illusion means misperception of a stimulus, right? So what is delirium? Delirium means acute, cognitive disorder. It is not dementia. Dementia is also cognitive disorder, but chronic, irreversible. And patient also suffering language problem, memory problem, or personality disorder, or also difficulty to judgment. But delirium is acute, reversible, cognitive disorder. What else?